And we are live, Dr. Patty.
Thank you. Good morning, everyone, and welcome board and online viewers to the January 8th, 2025 Board of Health meeting. Happy New Year 2025. We are starting a brand new year. The board meeting is officially called to order at 8 a.m. This virtual meeting is being streamed via Facebook and will also be rebroadcast on Facebook and YouTube. I hope all of you are safe, warm, and well. Also hoping the winter storm didn't have a severe impact on you or your families. Let's begin today's meeting. The December Board of Health minutes were distributed to the board for the review prior to this meeting. Are there any discussions or amendments to the minutes?
I move adoption.
Second.
May I have a second?
Second.
All in favor, please raise your hand or say yay.
Aye.
Aye. Yay.
Thank you.
Aye.
Any opposed? No oppositions. Any abstentions? Motions are approved as distributed. Thank you very much. Regarding doctors, we're going to go to the chair's business updates. Regarding Dr. Ransdell's concern that he shared at our last meeting about policy measures that would ban the use of fluoride in public drinking water systems, I hope you had the chance to read that the Kentucky Health Departments Associations released a statement against such a ban on November 18, 2024. We have that letter distributed by Ms. Glenn before this meeting. And in that letter or that notice states that the importance of fluoride as a proven safe and effective tool for reducing dental decay across all age groups. Dr. Ransdell, is this enough, or would you like go ahead and get a letter from the Board of Health from Louisville Metro Public Health and Wellness?
I mean, I think this would be wonderful. I contacted the Louisville Dental Society and Kentucky Dental Association, and they do not have their own. They obviously are in support of community fluoridation, but they do not have their own statement. And I also contacted the American Dental Association, which I know that they do have a statement, but nobody got back with me, and I unfortunately did not have time to follow up with it. So I would be happy to do that as well.
Okay.
You know, I
so we'll
thought
work,
that the
we'll
statement
work
was
on
a
that.
very good statement.
Okay, so we'll work
Okay.
on that, and then we'll let everybody
and the
else in the
additional
board.
information.
Okay, thank you very much.
Okay.
The U.S. Surgeon General recommends the realignment of our lives around healthy relationship, service, and purpose as a triad of fulfillment and the core pillars of the community. According to Dr. Murthy, community should be recognized as the irreplaceable foundation of our well-being, and he invites all of us to choose the community. I'm really grateful for all of you present today here because you are choosing community to build up, who we are and our future. He also recommended cancer warnings to be placed on liquors and other alcoholic beverages. This based on a report that showed that alcohol consumption increases the risk of developing at least 7 types of cancer: mouth, throat, esophagus, voice box, breast, liver, colon, and rectum. So we will be, I'm sure we will be reading a lot more about this in the near future. Now we're going to go to our perspective sessions. Last year, at the end of the 2024, Louisville Metropolitan Health and Wellness shared a document titled Louisville Health Equity Data, which we share with you for your review. And today we have Dr. Trey Allen, PhD, Louisville Metropolitan Health and Wellness Epidemiologist Manager, and he will be presenting Louisville Health Equity Data Dashboard. Dr. Allen joined the Louisville Metro Public Health and Wellness as an epidemiologist in 2020 and was promoted to epidemiologist manager in 2024. He works with a team of epidemiologists whose work is dedicated to using data to understand and address the root causes of adverse health outcomes in Louisville. Dr. Allen holds a Master of Arts in Sociology and a PhD in Applied Sociology from the University of Louisville. Today, I present to you Dr. Trey Allen. Dr. Allen, if you can start, the floor is yours. You have 20 minutes. Thank you very much.
Thank you very much. Really quick, can you hear me okay? And can you see my screen? I'm seeing head nods. Thank you so much.
Yes, to both.
Thank you so much. So as introduced, my name is Trey. You can Trey. I am an epidemiologist manager at the Louisville Metro Department of Public Health and Wellness. And the team that I work with use data and create data tools to help understand the root causes of health and to evaluate program and policy efforts related to improving community health here in Louisville. A little bit more about my team. My team produces all of the analysis and visualizations that you will see on the health equity data dashboard that I'm going to show you. Today, we're going to give you a high-level overview of our health equity data dashboard. This will include a demonstration on how to access the dashboard. We'll spend some time looking at what information is on the dashboard for you to access. And we'll discuss some ways briefly that we envision this dashboard being used by community partners. If you have questions, I would love to answer those, and we should have space at the end of the presentation for addressing those questions. So by way of giving a little bit of background, Louisville Metro Department of Public Health and Wellness's mission, which you may be familiar with, is to achieve health equity and to improve the health and well-being of all Louisville residents and visitors. On my team, we have a saying that the data that we work with is the community's data. We're just finding a way to give it back to them. And so the Louisville Health Equity Data Dashboard is a tool that we created to ensure that our partners in the community have access to their health data so that they can better position themselves to address health needs in the community. One of the things that I appreciate the most about this dashboard is that it gives us a platform to proactively make sure that up-to-date data that many of our partners use is available. So really quickly, how to access the dashboard. There's a few ways that you can access the dashboard. If you're in a presentation like this and you have access to a QR code and you're comfortable using a QR code, you can scan that QR code with your phone, and that should take you directly to our health equity data dashboard. We have a wonderful communications team that can do things like make QR codes. If you're not in a space where you have access to that, we have the domain www.louhealthdata.com, and that will take you directly to our dashboard. If you're having trouble remembering either of those, our dashboard can be accessed from the Louisville Metro Government webpage. You just click on the Government tab, find, and I've lost it. But if you find the department's Public Health and Wellness, and then find the tab Center for Health Equity, the Louisville, the Health Equity Dashboard will be a tab under Center for Health Equity. Or as of this, when I tried Googling Louisville Health Equity Data Dashboard, it was still one of the top hits. So those are some ways you can access if all else fails. Please don't hesitate to reach out to someone at the department. We should be able to help you navigate toward. In terms of actually looking at the dashboard, so if you're there or following along on your screen, this is what the first page of the dashboard looks like. The first page has some useful definitions, such as what we mean when we discuss health, and what we mean when we discuss health equity. It also gives a short blurb at the bottom of how to best use the website. And for now, I just want to draw your attention to a few notes there. The first of which, and something that is unique to having a dashboard as opposed to only our static reports that we've issued in the past, we plan to regularly update this data. For most of the visualization, that means we're going to update them on an annual basis. But we also have the potential for new visualizations. So other health outcomes that are not currently represented on the dashboard, or we're exploring how we might best represent data at other geographies or across other time periods. If you look across the top, there are more focused tabs for more focused pages on the website. So the first one is our Health Equity Report tab. If you click on that, it will actually navigate back to our webpage, and you'll have links to our static health equity reports beginning in 2011, but going all the way up 2014, 2017, and 2024. The 2024 static report takes a deeper focus on how health inequalities in Louisville were created, and how we can move towards a Louisville where we experience health equity as opposed to inequities. Navigating back to the dashboard, an invitation to imagine is another tab. That page can be accessed either by clicking on that tab, or if you're on the home, click on the concepts and definitions link, it'll also take you here. This tab provides a snapshot of some of the content that you will see in the 2024 static report, and provides some important visions and terms for understanding how we can bring about health equity in Louisville. It has some concepts and definitions that could be useful as you navigate and use the dashboard to gain a better understanding of what for understanding the dashboard. The tab that is titled Health Equity Snapshot provides kind of a high-level overview of health in our community. In particular, we report on life expectancy on this page. If many of you working in health spaces may be familiar with some of our life expectancy maps. That is presented here. We represent life expectancy on this page across the county. We represent trends across time. So we have life expectancy in 5-year increments from 2011 to 2015, up to 2017, 2021. We compare life expectancy between groups, race and ethnicity, and gender. And we also have a clickable map with vital statistics, which is what we calculate life expectancy using. And that will give you a pop-up with the age-adjusted death rates that you'll see from vital statistics at other places in this dashboard. Also on this page are some useful demographic information about our county. We report on race and ethnicity from U.S. Census data. We have data on the languages spoken in our county, or primary languages spoken in our county. We have data on sex and gender. So a lot to give you a greater understanding of the demographic context of our community. The last thing that I'll draw your attention to on this page is the CDC's Social Vulnerability Index. That takes together a variety of measures and can be pretty useful for planning and thinking about the social context that gives rise to or is related to the health inequalities that we see in our county. The next tab that I'll take you to, and I apologize for speeding through this, is the first health outcome that we'll look at. Outcomes that we report on in the health equity data dashboard are reported as age-adjusted death rates per 100,000 residents. That just gives us a standardized unit to be able to make comparisons. Much like the life expectancy data, we report this data generally in 5-year increments. So you'll see that for now, we're reporting on data from 2017 to 2021. We compare between race and ethnic groups. We also make comparisons based on sex and gender. We further break down those leading causes of death. So based on National Center for Health Statistics, primary cause of death codes. And sometimes those are broad. So for example, for accidents and injury, the 5 leading contributors to that death rate are accidental substance poisoning, which include drug overdose and alcohol poisoning related deaths, vehicle related deaths, fall related deaths, pedestrian related deaths, and choking and breathing obstruction related deaths as the leading contributors to that accidental and injury death rate. Similarly, we report on Alzheimer's disease using that National Center for Health Statistics data and age adjusting the death rates. Some data, such as the data that we report on for arthritis, come from other sources, like the CDC Behavioral Risk Factor Surveillance System, or as we call them, my team, BRFIS. When we pull from some of those other sources, we make sure that we report consistently with how those sources report on that data. So for example, for arthritis, because the CDC reports using percentage estimates of the population per census tract, that is also what we report on when we report on arthritis data. For asthma, I'll really pay attention to that because it's a little bit different data source than some of the others on this dashboard. This data comes from inpatient hospitalization records. I want to offer the caution to interpret these rates differently than you would interpret the death rates, because these represents visits, not unique individuals. So a single patient having 2 inpatient hospitalizations in a year is going to be present twice in the data. For birth outcomes data, this is usually a page that there's a lot of interest from community partners in. We report on infant deaths per 1,000 live births. We report on births that are preterm, so those that occur before 37 weeks of gestation, and percent of low birth weight births, births that are low birth weight, babies weighing less than 2,500 grams at delivery. We similarly report this data in 5-year increments, and we use demographic characteristics of the mother, for example, mother's race or ethnicity, reported mailing address, etc., to make comparisons across groups to better understand health in Louisville. Notably, and I apologize, I didn't really point it out before, at the beginning, at the bottom of each of these pages, we have some discussion of the root causes that we have found to contribute to the outcomes that you're seeing on these pages. Quickly, I'll draw your attention to cancer and heart disease because those are consistently the leading causes of death in Louisville and Jefferson County. We also report on homicide in our health equity data dashboard. And lead is a little bit different data source, so I'll provide some context here. So this represents test results from 2015 to 2019 that were reported to us as a health department, where blood lead levels for children under the age of 6 were above 5 micrograms per deciliter, which at the time was the CDC's threshold for unsafe lead levels. Since 2021, that measure has been updated to 3.5 micrograms per deciliter. The CDC emphasized no safe level of lead. As an additional note, we are limited in some measures by the data that is reported to us. So, for example, we know that this doesn't include all of the lead tests that exist in Jefferson County, but we do know that it accounts for a majority of elevated blood lead tests in the county. If you need to, at any point from any of these pages, get back to the homepage You can do that by just clicking on the title of the dashboard. So last kind of things from me before we open the floor for questions. Some tips about how this dashboard could be used or referenced. Again, my team's goal is to get the data into the hands of community members and stakeholders. We encourage Board of Health members, community members to use the health equity data dashboard for things like strategic planning. Entities that have personnel, programs, and services that can be deployed in a strategic way. This data could be useful for informing that deployment. We encourage using this data for health needs assessments and understanding the context of health needs in our community. And certainly this data can also be useful for applying for reporting back on grants or to donors. We'll offer the disclaimer. We caution people against using health equity data dashboard for term changes. This data largely represents long-term trends. Most of the health outcomes that we present are long-term and multifaceted, and any one program or policy isn't likely to have a measurable short-term impact, especially on mortality rates. But again, certainly useful for understanding the context of health needs in our community. The last thing that I will offer is that, again, the goal of this data into the hands of community members. If there's data that you need that isn't represented here, please feel free to reach out to us at the health department. If we have the data, we will do our best to get it to you in a form that's useful. If we don't have it, we'll do our best to point you in the direction where you might be able to get that data, or get you something that's similar enough to fill your needs. But with that being said, I'd like to open the floor for discussion, questions. If there's any tabs that you want to look at, again, I'm happy to navigate to that. Thank you.
Thank you very much for this great explanation on how to access and how to navigate, and best of all, to take a look at all the information that we have available for the whole community. Any questions, any comments?
One quick question. In terms of social determinants of health, I know that's a hot buzz topic that everybody's looking at. Is there data available from that standpoint? Because I know most folks are interested in that. It's great that you have disease-specific data, but just overall social determinants of health.
Sorry, I got to find my microphone. We do not currently have a lot of social determinants of health data on the dashboard. We have discussion of a lot of what we would call social determinants of health. We discuss them as root causes. Some discussion of those general root causes at the bottom of these tabs, and that's certainly in the 2024 static report. But I think where a lot of that data comes from other sources like the census, we just don't currently have that on the dashboard.
Thank you.
Thank you,
Anybody
Dr.
else?
Allen. Yes, thank you, Dr. Allen. This is Anita Bhatia from GLMS. I had a question. I read that there's a marked reduction in the substance abuse tragedies in Louisville, but again, there's a discrimination in the equity that we see that it has reduced a lot amongst the Caucasians, but not so much amongst the African Americans. And what are we doing about that? Or do you have any further information?
Yeah, I would say as far as answering like specific program and like efforts to address health inequities, I would have to defer to other teams on that. I'm here in this space to present on the dashboard, so I'd defer to definitely other people. I'm sorry.
Thank you, no problem. Thank you.
Thank you. Anybody else?
Yeah, I just wanted to thank you, Trey, for this presentation. I am excited to see all these updated data available. A lot of the faculty in our School of Public Health and Information Sciences use these data to write grants, and so it's helpful to have all of these data compiled in one place. And I just wanted to ask, and maybe this was the plan anyways, if there could be a brief email, Patricia, following today's meeting with the link to this so that we could easily push this out to, in my case, to the faculty in our school. Thank you.
Certainly, and Kathy, let's see,
I can help with that.
our
Dr.
our
Patty.
chair, Kathy Turner just shared the email, the link, but we will do that, Dr. Cardarelli. Thank you so much. And Dr. Bhatia, we'll find out who can help us to answer your question. Anybody else? Thank you, Kathy.
Yes, I just have a quick comment. Dr. Allen, first, I really appreciate your presentation, and I think this is a great direction in terms of making this data available. By the way, I'm sorry, I didn't introduce myself. I'm Dr. Scott Hedges. I'm the Chief Medical Officer for 7 County Services. That's important because it's related to my comment. We would love at some point, and if this is kind of off topic for today, but to be a partner in thinking about how we measure health equity, not only in terms of the topics and the areas that you have here, but there's lots written even at the federal level around health equity for behavioral health and substance use disorders. And it would be a nice tab to see those up at the top, to have some of that expansion at some point. I think that may be a future project that we could collaborate on, and be happy to participate in that. Thank you.
Dr. Bautista?
Thank you, Dr. Hedges. Yes.
I'm sorry that I can't figure out my PC to do this more politely. However, I am concerned about mental health and behavioral health, but especially as it relates to veterans. And I've had extensive conversations nationally and in the state and elsewhere with regard, and our own foundation at Humana, in terms of funding, because veterans are one of our priorities. And as we hold the TRICARE contract. So with that said, can someone share what if the city has a separate veterans initiative or has joined any particular coalitions?
Chief Health Strategist, Ms. Mendel, you wanted to share a comment before, and if you could help us with the question from Ms. Margolis, please.
Sure. And let me go back to Dr. Bhatia's question as far as substance use disorder and overdoses. So, we're happy to see last year nationally and in Kentucky a reduction in the number of overdose deaths. Unfortunately, we are still seeing an increase in our Black and Brown populations, so particularly our Black residents. So we have a lot of work now and some expansion work scheduled for next year, specifically for reducing overdose deaths with our Black residents. On to Ms. Margulies' question as far as mental health and veterans. We currently, as a health department, are not doing work in that space. Would love to hear from 7 counties. And Dr. Hedges, is there any information that you can share with work that you all are doing?
Need to get faster at hitting my button. Sorry. Yes, I'd be happy to do that. So veterans, as a CCBHC, a certified community behavioral health organization, addressing the needs of veteran populations is part of the federal mandate to continue to participate in that programming. Admittedly, we're growing it in that area because the treatment of veterans is, particularly since we have the visit here in Louisville, has largely been the purview of the VA. But we have been founding some great relationships with the VA hospital and expanding services across. And whoever I need to coordinate with to continue that conversation, we are looking at ways to gather more information. I will put my, let's see here, if I can figure out how to put something in the chat. I will put my email address.
Dr. Hedges?
Yes.
It's Heidi. I'm going to put someone from the Humana Foundation in direct contact with you. So,
I think you still have my email address. Is that not true, Heidi?
well, I don't have anything right now as we speak, since I'm on this and don't want to disrupt my this conversation. But can you resend it to me at hsmargulis@gmail.com?
You betcha.
You're wonderful. And I'll get you together with Kenny Winchester, who is the Humana Foundation person. We have dedicated $3 million to the VA here. So that's an indication that we're intent on making measurable, actionable, not policy, but action to help stem the root cause, you find the root cause and then have metric driven results. And we've got some national experts involved.
Heidi,
Thank you very much to both. Yes, go ahead, Dr. Hedges.
No, it's just an exciting topic for me, and I could probably eat up too much of this team's valuable time. So I defer to you, Chairman. I'm sorry.
No worries. Please remember that every time that Ms. Alana Glenn shares any information with us, all the emails are contained within that message. So just that can be a referral for everybody. And Dr. Allen, if you could just take into consideration Dr. Hedges regarding mental health. Is there anything regarding mental health included in the dashboard?
Yeah, so of I think growth on our team, we are building out our capacity and improving all the time and trying to figure out or automating how we're going to be updating this data, which will improve our capacity to seek out other spaces where we can report on data. One of the limitations that we have as far as represent, it just depends on the data that we have access to. So vital statistics records, we have really good snapshots of data from people at the beginning of their life course, so when they're born, and really good data for when people pass away. And so the in-between is a lot more complicated to get at, but we are very interested in exploring ways to better understand that context, and definitely, seeking out recommendations, partnership, how to best, represent and understand those needs in our community.
Well, and Dr. Allen, I would just comment. I want to reiterate here at the end of my comments what I began with. This is a huge step forward for our community. And the struggles that you just articulated are true across the country. Nobody is doing a great job in including things. I mean, my particular interest is in behavioral health and substance use, but there are other issues that are chronic illnesses that are really difficult to track and get a really good footing. So the fact that this is on our radar and as a community, we're making this information public, I applaud you and the work that you're doing. There's so much opportunity here for us to continue to grow, and any way that we can support would be great.
Thank you so much. Thank you. Thank you, Dr. Allen, for your presentation, and thank you for contributing to our perspective session this morning. We're going to continue with our agenda. Unfortunately, Deputy Mayor Nicole George won't be present today at our meeting. So we will continue with our Chief Health Strategist, Dr. Mendel. She shared the director's report, and that was distributed along with the minutes. Welcome, Chief Strategist.
Good morning. Thank you. I'm glad to see all these faces. Everyone looks warm, thankfully. You should all have a copy of the report. As always, there's a lot going on within the Department for Public Health here in Louisville. The first thing listed is we have an increase in cases of chickenpox. So we are seeing varicella more in the community than we have in the past. Our staff did some really nice media interviews, so you may have caught those. What this will direct you to, like, again, we are seeing more cases than we have seen in several years. So far, well, I guess this is last year's data. So at the time of this report, 14 cases had been reported. Majority of those are either unvaccinated or with children yet to be vaccinated. So all of these are unvaccinated cases. So the messages for this is, one, please continue to encourage varicella vaccinations and reporting. So there are links to the proper forms on our website and more information around chickenpox. There's also a link in the report to our new influenza surveillance dashboard. I'm sure, as most of you are well, we are seeing an increase in flu cases along with other respiratory viruses this season. RSV cases are also higher. And, we saw an increase in COVID cases. It's not too late if someone has not received their flu vaccine to get that. It will still provide some protection. As we know, flu season will go for the next few months. So we're really excited about the safety series for our Healthy Start families that we worked with Baptist Health, Norton Children, and other organizations to create an educational series, Safe and Sound. If you're interested or would like to be more involved with information, please reach out to us. Of course, nothing is more important than keeping our children safe. There's also a link in the report to our FY24 annual report. We'll give you a great idea of the comprehensive work that's being done throughout the department. The next section I wanted to point you to relates to the overdose deaths and reporting that we've seen. So we're really, really excited that we're partnering with some of the fire departments across Louisville for naloxone distribution boxes. We're doing everything we can to saturate the community with Narcan and naloxone to prevent overdoses. So just like I had mentioned earlier, and the questions as far as our Black residents and how we're seeing those increasing. So we're doing partnering with the Louisville Fire Department was one way, and also with Shively Fire Department in providing 24/7 access to free naloxone. So far, over 520 units have been delivered. So there's also, you can learn more about where to find naloxone in Kentucky. We have all kinds of links embedded into the report for helpful information, but just to access that of where you can find naloxone and share, please, the information as far as those being available in 20 fire departments across Louisville. So just a lot of information going on. Please read the full report. If you have any questions, reach out. If there's opportunities for partnerships and collaboration, we're always interested in doing that. So thank you.
Connie, I have a quick question, if you don't mind. And I'm actually just seizing the opportunity to pick your brain here a little bit.
Okay.
At 7 counties, we've been wrestling with, we make Narcan kits available in all of our service sites as well, part of the larger participation.
Mm-hmm.
But we've been wrestling internally about staying with the 4 milligrams dosage or looking at the 8 milligrams from the Loxado product line, I think. um, partly because in our own non-scientific sort of review, with many of our overdoses that are showing up at our service sites, and we have that, a single dose is far from sufficient. And there's some at least intriguing evidence that an 8 milligram initial dose is represents some opportunities for benefit, particularly if somebody is already non-responsive or hypoxic. Have you all looked into that and what you make available to the community and had thoughts about that in that particular area?
So I absolutely agree. There has been on many occasions that the first dose is not enough, and we do proceed with the second dose. I will say through our Narcan training, so providing that to the public, we're recommending currently the lower dose, but to continue, administering and well, one, calling 911, but continue administering until someone does respond. So, but what I'll do is connect you with our staff to get more information, and again, they would have the specifics on what we're seeing, and that may be something, yeah, that we would consider working together.
Thank you.
Mm-hmm.
Thank you very much, Chief Health Strategist Connie Mendel, for the update. We will proceed now with Family Health Centers. Now I yield the floor to Dr. Bart Irwin.
All right, thank you. I don't have any updates, but I believe Ashley Shoemaker has a Medicaid update for you.
Yes, the coalition.
Thank you.
Hi, yes, the coalition met on December 9th. The Marketplace open enrollment is ongoing now through January 15th. So Marketplace plans on Connect are for people who are not eligible for Medicaid because the income is too high or for other reasons. They can purchase a Marketplace plan and may be eligible for a tax subsidy to lower the monthly premium costs and other cost sharing. So far, this has been the best open enrollment that we have had since 2015. So in almost a decade, we've had a record 93,000 individuals statewide who have enrolled in coverage so far. We do have an update from just last week. The Biden administration had extended Marketplace eligibility to a category of immigrants called DACA, or Deferred Action for Childhood Arrivals. These are young adults who arrived in the U.S. when they were children and did not have any immigration documents. They are have obtained employment authorization and are allowed to live and work in the United States without fear of deportation. But up until now, they have not been considered eligible to enroll in a Marketplace plan. The Biden administration had extended coverage to them starting this year. However, due to an ongoing lawsuit filed by several different states, 19 states, including Kentucky, are not currently enrolling DACA recipients into Marketplace plans. And people who have already enrolled are having their plans terminated. If they've already made a premium payment, the issuer will be refunding that to them. But they are getting notices. I believe they received notices last week letting them know that that their plans were being terminated. Our next meeting is scheduled for February 10th at 4 o'clock.
Thank you very much for this great information and not so great information. We appreciate it. Now we go to JCPS.
Sorry.
Yes.
Ashley, when did you say the open enrollment period for the Marketplace plans is over?
It ends on January 15th.
Thank you.
So we have barely a week for all the people that haven't applied for Marketplace. So let's encourage, if you have parts of the community that needs this, remind them, please. And now we thank you, Dr. Eccles. Now we go to family health, to JCPS Health. I yield the floor to Dr. Eva Stone. Thank you so much, Dr. Stone.
Good morning. Yeah, just there's always things going on in the school. Connie, I had to smile at your, chicken pox and whooping cough. We've been chasing all year in JCPS. So very glad for our partnership. We've got some great systems in place with your team. We appreciate that so much. So just on our end, some good news. Our electronic health record that we use called School Care, we have interfaced with the Kentucky Immunization Registry. So we're able to get data, ongoing records from the state now, regular imports, and that'll help a lot in our work. As I've shared several times with this group, we have an immunization crisis. And access issues for kids to have vaccines. We've got close to 20,000 kids who show as not being current on their vaccines. And part of the challenge is that it's not like they just need their tetanus booster. These are children that need complete series of vaccines that they've not had. So lots of work happening in that area. We are administering vaccines. We're VFC providers, if you aren't aware of that. And so that's going well. We have given over 2,500 vaccines so far this school year to over close to 750 children. So we host in-school clinics. We have 4 sites across the district that are VFC locations. We also hold clinics where parents can bring children if they don't want their kids vaccinated at school. So lots happening in that. The only other update I'll share, just for awareness, is, as you know, the 1st of January in Kentucky, the medicinal cannabis laws went into place. And so JCPS does have a policy allowing the administration of medicinal cannabis for those children that meet that criteria. So we're in the process of training nurses and staff on that at this time. And that's all the updates I've got.
Thank you so much, Dr. Stone, for sharing with us all this valuable information. We proceed with Greater Louisville Medical Society. I now yield the floor to you, Dr. Anita Bhatia.
Good morning again. Not very much to report because it's been a little quiet holiday season, but certainly want to reaffirm that the mission of the Greater Louisville Medical Society is to empower the physicians of the society to advance meaningful advocacy in health of the community. And this is why we have the Doctors' Day that we meet in Frankfurt. And this is why the Kentucky Medical Association, which is promoted also by all the representations from the Greater Louisville Medical Society, with resolutions to help advance advocacy in the health in the community. And we also do bring about impactful relationships in the community with itself. And that's why we hold these events like the Wear the White Coat ceremony, wear the white coat, where we invite, I've talked about it last time too, maybe invite people from the community to come and experience what it is to live a life of a physician on a certain day. Dr. Hargett will be giving us a meeting, highlights of his panel that he had for medical students, and that will be on the 10th of this month. We have the board meeting on that day. We also have like I said, the Doctors' Day, and then we have the Doctors' Ball on March 8th, 2025, where we celebrate outstanding physicians for the work that they have done at their institutions and in the community. And that will be all for my report.
Thank you, Dr. Bhatia. We will now have our committee reports, and we go to the Immunization Advocacy Committee. I now yield the floor to Dr. Ruth Carrico.
Thank you so much. It's so great to hear all of the work that is going on. So the Immunization Committee, again, our focus has been on how do we get information out to the community regarding where individuals within the community can receive vaccines or vaccinations. So our partner was the Immunize Kentucky, and they dropped off the map. I reached out to them, and apparently somebody got a hold of their website, and I think they no longer own their website, and it's been a kind of a catastrophe for them. So if any of you have experienced the same problems we had in reaching them, they're trying to recover from that. So I talked to Joey Parsons from the Rural Health Association, and they are working to try to get their projects back online. So that's kind of taken the wind out of our sail a little bit in being able to get that information out. However, Stephanie Lotkis and I went and met with members from Trifecta Medical Group. They are a VaxCare clinic. They have all vaccines on site, and to see how they may be able to help in any way with individuals that maybe contact the Louisville Metro regarding immunization. They can refer them to that clinic so they can do walk-in, and they, as a VaxCare clinic, they operate then as a pharmacy as well. So that means that they can administer any of the Part D vaccines as well. So this may help augment all of the work that is being done by BART and all of the sites across Kentucky with our area with family health centers. And then even I touch base to see, is there anything then that Trifecta can do? So this may be something to offer. And I think it's just worth reminding that, individuals 65 and older that may have had their first COVID vaccine, or those that fit into those populations where there's increased medical need, they are probably coming across the time where they may need a second dose. So just as a reminder, and then if there is any help that can be done, provided for Greater Louisville Medical Society there, I've talked to Trifecta as well about, is there an opportunity to open that office so that any provider who wants to know more about having vaccine on site in their clinic, if it would be of help to see what it means when you work with VaxCare, to have them providing the vaccine and doing the, taking the liability with respect to inventory and then doing the billing and so forth. So some clinics may feel like they simply cannot afford to be a vaccinating office. This may be able to answer questions so that they can make that decision. We're in a new time. So I think it's certainly worth then saying, let me go back and revisit that, particularly with the number of vaccines that are on the rise that really fit into not only primary care, but many of our specialty practices. And I think it's worth mentioning the vaccine pipeline also includes a vaccine for E. coli, urinary tract infection, that is part of the sepsis initiative, sepsis prevention initiative. And I think Moderna also has a norovirus, a candidate vaccine for norovirus. So, there are so many I think, new opportunities for vaccination that really prompt our evaluation of where we are in our clinics, in our medical practices. So, this may be an opportunity to say, hey, let's get heads together again, have an open discussion. What does this mean to our practices? What does it mean not only for the patients, but from a finance perspective? Because we know that, our clinics have to be able to pay the bills. They have to be able to survive. So, what does this mean? And, this may be some new opportunities for conversation. So that's what we're looking at in our committee, and we'll continue then to make information available. I think Trifecta is also doing some outreach to the Kentucky Office for Refugees to say, is there, some of our refugees, our immigrants have gone to pharmacies to receive some of the vaccines that are now part of the new customs and immigration requirements, particularly polio vaccine. This may be outside the protocols for some of our pharmacist colleagues. So our refugees and immigrants have had difficulty receiving that. So this may be an opportunity for them to receive that vaccine. So, I think it's worth having broader conversations. So these vaccines are available in every place where care is provided for our special population. So, this may prompt some additional offline conversations outside this meeting, but I want to push that out, that there is at least a site where the vaccines can be made available. And then if others are interested in looking at this, what does it mean to have VaxCare helping them? And there's a lot of confusion regarding what's VaxCare, what's VaxServe, what's VaxSource, what's Vax blah, blah. Everybody's got a very similar name. And so sometimes it can be confusing. So thanks for the opportunity to share that information today.
Thank you so much for the information and your advocacy, Dr. Carrico. Is there any old business that we should take care of? If not, is there any new business that we should take care of? I want to thank everyone for taking time to participate in this month's meeting. The next meeting will be held on Wednesday, February 5th, 2025 at 8 a.m. This will be also a virtual meeting. If there is no further business, the meeting is officially adjourned. Thank you so much. Have a beautiful day. Good morning.
Thank
you all.
Thank you.
Thank
Happy
you.
New Year.
Yeah,
Happy
have
New
a
Happy
good
New
sleep
Year to
good after
everybody.
2025. Yes, we're ready.
Yes.
Oh,
Thank you so much, everybody. Thank you.
thank you.
Bye.